Hey guys, it's Kent here, and we've been asked to comment on this video above, so I've just green screened it in the background. And what this looks like is it's a wart treatment. So when we do this in the podiatry clinic, usually you've got a cluster of warts, or you can use it on sometimes just one wart. And you can see that the what it is, it's a salicylic acid treatment. And what you do is you use a really strong salicylic acid, might be up to 70% salicylic acid in peanut oil, and we place that on the warts. And what that does, so if we'd imagine the wart is this thick, the salicylic acid will eat down that much, and then we cut that top layer off, and then we go again and cut more of the wart out, or kill more with the salicylic acid, and then we cut more of that up. So what's happened here is most likely they've put the salicylic acid on each of the individual warts, and then to keep it in place, they've used like a strapping tape or a zinc oxide tape, that is what you could see removed before, over the top, and then you keep that dry for about 3 days, and then you come back to the podiatry clinic, and then we shave those out to try and just debulk those warts, and eventually we get cut all the way down through the wart, and the wart is then gone. So usually you can tell when the wart's gone, as you can see we call it the landscape of the skin underneath it. And in a warty tissue, there's no landscape like fingerprints in the tissue, but then once we've cut through all the wart, you can actually see the dermo-epidermal junction, or the landscape to that area. And you'll be able to know when you've cut all the wart out, when those landscapes or the fingerprints in the skin are actually all connected up again. So this looks like it's a salicylic acid treatment for warts. It can be really quite painful. You've got to be very, very careful when you do this. You can get some over-the-counter stuff that will do a similar job called duofilm at the chemist, but again, you have to be very, very careful. It's nowhere near as strong as what we use in the podiatry clinic, but then it won't hurt as much either. So please be very, very careful. This is not for diabetics or any immunocompromised patients, but I hope this answers some of your questions.